Remedies for colic. Any parent will tell you that colic is one of the most excruciating experiences of early parenthood. The baby cries as if in dire pain, and there just seems to be nothing for a parent to do. A baby is suspected to have colic if, around the age of 3 weeks, the baby starts crying inconsolably for hours at a time. The condition is termed colic because it was assumed that babies were crying due to stomach pain. Doctors are no longer sure that a stomach ache causes colic, but the term continues to be in use. The first step is to ascertain the cause of distress. Newborn babies often cry because of hunger, earache, wetness, or cold. If these factors can be safely ruled out, crying can be attributed to the mysterious colic. Sometimes little tummies do not agree with the protein in traditional baby formula or from a mother's milk. After consulting your doctor, change the formula. Switch to a soy-based formula. Even in breastfed babies, an excess of cow's milk products in the mother's diet can cause tummy aches. Root vegetables and highly acidic food products like chocolates, tomatoes, or grapefruit in the mother's diet can also upset the stomach of a feeding infant. Gas-producing food like broccoli, cabbage, onions, cauliflower, peppers, and citrus fruits may all become suspect at such a time. Your doctor may advise you to go on an exclusion diet for some time. Most newborns outgrow their sensitivity to food and become naturally vigorous and robust within 3 to 6 months. If the baby is being breastfed, it is necessary to feed on demand. The evening hours see a decline in production of milk. Feeding the baby often during these hours will ensure an abundant supply of milk. If the baby is being bottle-fed, care must be taken to hold the bottle properly, so that there is no swallowing of air. Patting the baby gently on the back after each feeding is another effective method of releasing gas. With the increasing incidences of cot deaths, doctors advise parents to put their babies to sleep on their back. However, sometimes babies with colic like to lie on their stomachs. This is safe, so long as you are awake and vigilant. Doctors sometimes attribute colic to maternal stress. It's only natural for mothers to get stressed when little babies cry until they are red in the face. But babies are very sensitive to stress, and a mother whose nerves are frayed cannot calm a distressed baby. At such a time, mothers should get extra help and spend some time away from the scene. Take a warm bath or go for a stroll. Traditionally, colicky babies have been fed with gripe water approximately half an hour before feeding. But these products should be checked for their ingredients. Some may contain artificial ingredients and preservatives. Sensitive digestive systems of colicky infants can definitely do without such irritants. A warm aromatherapy bath calms and soothes the baby. Add a few drops of lavender to warm bath water and gently massage the tummy. This will help relieve painfully trapped gas. Babies also like to be in water. Small babies need a lot of warmth and security. Swaddling the baby in warm clothes and holding it against the steady soothing rhythm of a parent's heartbeat can sometimes soothe the baby's pain. Walking, rocking, and repetitive movements also have a calming effect. Applying gentle pressure on the abdomen will help relieve stomach ache. This position is known as the colic hold. Finally, remember, colic is a stage in the growth of your baby. This too will pass. Natural remedies for colic. Colic is a normal phase in the life of a baby during the first few weeks until the 3rd or 4th month. Doctors believe that the excessive crying makes parents more aware of the responsibility of raising a child. There is no miracle drug that can help treat colic babies. Parents will just have to face it until the child is able to adapt to the new environment and use some natural remedies along the way. One of the simplest ones parents can use is music. This is probably the reason why lullabies were invented, and those who don't have a singing voice can get the same thing on compact disc. This should be placed whenever the infant is in the crib, which can help it sleep comfortably. Another natural remedy is the diet that the mother is having. Certain foods produce gas, and when this is converted to milk, it is like passing on the same thing to the child. A dietitian can make a plan so this will not happen. If the mother is no longer breastfeeding and is relying on milk concentrates, perhaps switching to soy milk instead of the regular kind can help the colic baby. Some parents think that the infant can survive on breast milk alone in the first few months. Babies also need water, and this should be checked before giving it to the child. A good way to do this will be to read the ingredients on the side of the product label. When a colic baby is crying, parents will normally carry the child. This works, but since motion comforts most infants. If the mother is having a hard time carrying the baby, another way to do this will be to go out of the house. The woman can put the baby in a carriage or strap it to the car seat so both mother and child can spend quality time in the park or for a joyride. Babies at a young age also get stressed out. Giving the infant a massage, a warm bath, or using aromatherapy can help comfort the infant. The individual can also use a hot bag and put this on the belly and making sure that the water is not too hot. Babies are colic because of the new environment. No one can blame the infant, especially when the home has been the mother's womb for the first 9 months. In order for the baby to slowly adjust, parents can try swaddling or holding the infant close to the chest. This will make the baby reminisce how it was like before. The various natural remedies are effective. This may not work all the time, so the parents should try something different or a variation when things have not improved. There are of course medications available that can treat colic babies. Parents should consult with the doctor first which one will do the trick before administering it to the infant. Parents should not panic if the child is classified as colic. This is because it is not a disorder, and this is a good indication that the baby is normal. Both the mother and father should be ready for some hard days ahead, since there will be a lot of sleepless nights making one feel very exhausted.